please. The impact of perinatal behavioral health disorders is huge. So if those statistics on maternal deaths were not enough to illustrate, which I think they are, right? We can also understand that even if a behavioral health condition does not contribute to a death or does not end in a death of a mom, they are still like one of the most common complications of pregnancy. That includes, so when I say that they're one of the most common complications of pregnancy, I am including considerations for medical complications such as preterm birth, those things. So when you look at behavioral health prevalence and impact, just know that behavioral health conditions either exist on their own or co-occur frequently with some of those other complications and can make those complications even more severe. We also know that unidentified, untreated, or undertreated behavioral health conditions increase risk related to some of those other disorders. So, for instance, we know that maternal depression during pregnancy is associated with an increased risk of low birth weight and other pregnancy complications. A recent study also showed, I was just reading it this morning, that maternal depression in pregnancy is associated with slower rates of fetal growth between 30 and 37 weeks gestation, right? So even in pregnancy, we can see an impact on baby's growth and development that is directly related to the mental health of mom. Interactions between a caregiver and a child are truly essential for healthy infant and child development, especially if this is interfering with mom or dad's ability to caregive in the way that they want to or to bond with baby. This is really important that we take care of the behavioral health of mom and really any caregiver so that they can then caregive for the rest of their family. The absence of responsive caregiving can absolutely lead to disparities in learning and behavior for the child. And those disparities can really impact the entire life course of the child. So there is a huge impact on those early years that we can see have ripple effects through the rest of the child's life. We also have added some broad economic outcome information here. There is a kind of an impact like metric calculation that has been developed by a collaboration of programs that focus on psychiatric access in the state. And they actually did the math and found that untreated perinatal mood and anxiety disorder, so we're talking about, again, like depression, anxiety, or some of the most common, the cost estimate on leaving those untreated is around $35,000 per mother-child pair from pregnancy through the first 5 years of a child's life. So if we applied this to the Kansas birth rate of just under 35,000 births per year, we could estimate, based on prevalence data, that about 7,000 women in Kansas every year will experience a perinatal mental health condition. If less than half of those receive treatment, which we know access is an issue, so it's not unlikely that that would be the case, that would result in a conservatively estimated $19.5 million in cost of untreated perinatal mental health disorders per year, which means that untreated perinatal behavioral health conditions in the state of Kansas could cost a total of $112 million over the course of pregnancy through the first 5 years, right? So that's a huge, huge economic cost. So that's a lot of impact, but let's pivot a little bit, go to the next slide, and then let's talk about some of the things that are happening in Kansas. that we're working on to improve perinatal behavioral health, to improve outcomes for moms, to make sure that families have what they need um, during this time. Next slide, please. All right, so this is a lot of information. We're just going to talk through it, right? So I mentioned at the start that we were going to do a very high level overview. This is a kind of web of connections that illustrates some of the major initiatives and efforts happening in the state of Kansas um, related to perinatal behavioral health, right? So a lot of this is housed under the Kansas Department of Health and Environment. There are definitely other partnerships, but KDHE is really leading the work in this in terms of like systems statewide work, right? So I mentioned statistics from the Kansas Maternal Mortality Review Committee earlier. That 2016 to 2020 data report resulted in starting the MAVIS project, which is Maternal Anti-Violence Innovation and Sharing. We'll highlight and talk through that project a little bit more in a few slides. But that's really in response to that finding that that a majority of deaths, maternal deaths in Kansas during that time period were the result of mental behavioral health conditions and violence. The Kansas Maternal and Child Health Division also oversees Kansas Connecting Communities, which is a psychiatric access program in the state, and Kansas Perinatal Community Collaboratives, which we'll also go over a little bit more in a few minutes. And then the KDHE also directly connects with the Kansas Perinatal Quality Collaborative and the Fourth Trimester Initiative, which we will also go into a little bit more detail. Next slide, please. So kind of within that web, there are some really key partnerships. This is not inclusive of all the partners. There are a lot of other partnerships that are happening to connect systems of care at the state level, right? But these are some of the major players. There have also been smaller projects over the last, I'm going to say 5 to 8 years that have kind of been focused on like a key piece of improving outcomes, right? So some of those partnerships have included like Wichita State University, DCF, KCSL, like Kansas Children's Services League, so many acronyms. And they have focused on, building resource guides, building directions and instructions and support into existing frameworks so that we can develop more resources like peer support groups in Kansas, developing training that's really specific for healthcare providers to understand what their role is in mandated reporting, right? So some additional partnerships are in existence or have happened in the last 5 to 8 years to really help fill specific gaps. Next slide, please. So let's talk about some of the points of progress that have happened as a result of these initiatives and partnerships. So the first thing that we're going to go over is Kansas Connecting Communities. This is the primary grant that I work on at CPPR. This is a perinatal psychiatric access program. So it is one of several programs in existence across the nation. I think there are a total of 14 now. We really work to build capacity for frontline healthcare providers to address perinatal behavioral health conditions. So KCC offers education, consultation, and support with referrals for really any healthcare provider working with pregnant or postpartum moms and families in the state. Next slide, please. Since it was started in 2018, Kansas Connecting Communities has trained over 1,000 Kansas providers to screen, provide brief intervention, including standard patient education, and refer or treat individuals who are at risk or experiencing perinatal behavioral health conditions. We've also supported integration of screening and referral processes in hospitals, primary care settings, maternal child health, and teen pregnancy targeted case management programs, home visiting, Part C. Really, anyone who has a hand in the care of that family during pregnancy or postpartum. Another big win is that we have seen screening rates and referral rates increase over time, right? So uh, sites, and I say sites very loosely, that really refers to anyone who we've helped integrate screening into their program or their clinic. And we have seen their screening and referral rates increase pretty significantly. And we've also seen the number of pregnant and postpartum individuals represented in these statistics increase over time, right? So all KCC participating sites at baseline, like total patients who they served were about 440 in number. In the fifth year of the project, which ended in fall of 2023, we saw that KCC participating sites were serving around 15,000 pregnant and postpartum individuals annually, right? So we just started a new funding cycle. I'm sure that that number will increase over this next funding cycle, but just want to point out that when we're talking about the increased screening rates and increased referral rates, this also corresponds to us being able to screen and refer and treat a higher number of individuals. Next slide, please. We also have had a lot of wins recently with Kansas Medicaid policy, right? So there were updates to the Kansas Medicaid policy in 2019, 2021, and 2020. And I will not draw the full timeline for you, but really as a result of those updates, Medicaid coverage for moms was extended to 12 months postpartum, right? So covering that full year postpartum. Maternal depression screens are now reimbursable during pregnancy and the 12 months postpartum under the mother's Medicaid ID. Depression screenings for other parents or caregivers, right? I mentioned like anyone who's a primary caregiver in this perinatal time period is really at risk for mental health conditions in that postpartum time period. So any of those caregivers are able to be screened, and the provider who's doing that screening is able to reimburse that under the child's Medicaid ID as a caregiver risk assessment. There's also no cap on the number of reimbursable screens, right? So a mom who's at high risk can be rescreened by her primary care physician, by the pediatrician in the postpartum, right? Like we can be checking in on that mom, and the providers who are doing that work can be reimbursed appropriately for what they're providing. Screens can also be administered by non-licensed staff now, including home visitors, community health workers who are supervised by licensed professionals, right? So that increases our ability to not miss moms who are struggling, right? If more people can talk to her, check on her, screen and be reimbursed for these screenings that they're doing, that increases the chance that we're going to identify all moms who need some support and be able to intervene. Next slide, please. I promised that we would go into a little bit more detail here. So this is the KPQC fourth trimester initiative that we had on that web of initiatives slide. This is a statewide collaborative, and they work on implementing AIM patient safety bundles and some other QI initiatives, so quality improvement initiatives. They currently have a network of 39 hospitals and 2 birth centers that are working to implement a maternal mental health patient safety bundle. That includes really standard education on warning signs of postpartum complications, comprehensive screening that includes screening for behavioral health needs, breastfeeding support, home visiting, WIC, housing, transportation, social determinants of health, continuity of care following discharge from the hospital with an OB provider or primary care physician. And really making sure that moms have everything that they need before they are discharged post birth, right? So this includes making sure that moms have a warm handoff or they have an appointment already set up with each resource before that family leaves the hospital after birth. KCC has supported getting mental health and substance use screening and referrals in place for this cohort. And we've worked really hard to help them in their work. So this covers around 93% of all births in Kansas, which is a huge win for our state. Next slide, please. This is another initiative from that web of projects, right? So this is the Kansas Perinatal Community Collaboratives. This is a collaborative model that uses a collective impact framework to both link, right, like statewide efforts with local efforts, and to strengthen the systems of care at the local level. So it pulls in partners from government, business, nonprofit sectors, community sectors, and they're really focused on ensuring comprehensive and coordinated perinatal care. So this includes local sites that offer prenatal education classes using the March of Dimes curriculum. They have also worked to make sure that local initiatives are connected to statewide initiatives such as KPQC to help support some of the local coordination happening between that pregnancy to birth to postpartum kind of transition. KCC has also supported the integration of mental health and substance use screening and the sites that do the Becoming a Mom classes, as well as MCH programs, et cetera, that are connected to this project. Next slide, please. And then the MAVIS project. So as I mentioned earlier, this was really in response to the maternal mortality review committee's findings that that violent deaths or deaths that included violence and or substance use and perinatal mental health conditions was a really big contributor to maternal deaths in the state. So that data found that homicide was actually the second leading cause of maternal deaths. Um, Substance use or mental health conditions contributed to over half of pregnancy associated deaths. So, this project is really focused on cross training perinatal care providers. And again, that term is really broad. It really refers to anyone that has a part in that care during pregnancy or postpartum, as well as domestic violence service providers and advocates to better identify and respond to behavioral health conditions and intimate partner violence in pregnancy and postpartum. So, really focused on that cross training and sharing resources to make sure that everyone who's having a hand in that care has what they need to respond appropriately to one of those situations if they see a family experiencing that. Next slide, please. Great. We're going to talk about some concrete resources and tools. Next slide, please. Thank you. That are for moms and families, that are for professionals, that are for everyone, right? So, first and foremost, these are resources that are specifically for moms and families. There are a lot of resources in this state. A lot of things exist at the local level, a lot of things exist at the community level, right? Um, and there's no way that I could give you all of those resources in the short time that we have, right? So, really want to make sure that there is an understanding that you can find local resources through both of these resources on the slide. So, we have the National Maternal Mental Health Hotline. Um, that is available 24/7. Anyone can call. It does not have to be the mom. It could be the dad. It could be a caregiver, a concerned friend, a family member, and they can help find local resources and support. They can also provide support kind of over the phone or by text to a new mom who's maybe struggling, right? Um, they are also connected with the suicide crisis line. So if they feel that mom really needs like emergent care, they can get her connected to the right resources to help her through that time. Postpartum Support International also has a helpline. They have local support coordinators that are located within the state of Kansas. And those local support coordinators can help connect moms to resources at the local level. So those are two really great resources that you can really hand out to um, any mom that you are coming into contact with. Next slide, please. We also have crisis and suicide resources. There is a suicide lifeline. You can call or text 988. It's 24/7 support. Um, if if you or someone that you know truly is in a crisis state and you are worried about their immediate safety, the local emergency department is the place to go, right? It is also really important during that time that if a mom either pregnant or postpartum goes to that local emergency department, it's really important that everyone involved in her care knows that she is pregnant or postpartum, right? Because um, that that is something that will impact her care, and something that really needs to be considered when those providers are managing her care. So if you or someone that you know or love is going to the local emergency department because they are in a suicide crisis or a mental or behavioral health crisis, and they are pregnant or postpartum, please, please, please do your best to make sure that all of those care providers are aware of the fact that they are pregnant or postpartum. Next slide, please. Resources for professionals. So I mentioned KCC provides education, training, and technical assistance support earlier in the slide deck. This QR code, and I believe the link is also in the chat, will take you to our overview page where you can request a training. You just scan the QR code, click Ask Us a Question. It will take you to a form where you can request information about training. We also have a listserv that you can sign up for at that link, I believe. And we blast all of our trainings through quarterly newsletters. So you'll be able to identify whether those training options sound like something you're interested in. Next slide, please. We also have programmatic tools. I think sometimes people have toolkit fatigue, so we also can do some TA for these. If you're thinking about integrating screening or referral into your program or into your clinic, we have a lot of really useful resources, including policy and workflow templates like reimbursement guidance, opinion statements, links to statewide resources. We even have a dedicated section of resources that you can give directly to moms and families around perinatal behavioral health, including mental health and substance use in these toolkits. If you want some help figuring out how to implement this in your program or your organization, on that form on the previous slide, there's also that same form, there's a spot to say, like, I'd like some technical assistance around this. Slide, please. For physicians and clinicians, which can include therapists, really anyone who is managing treatment and care of that individual who is at risk for experiencing a perinatal behavioral health condition, Kansas Connecting Communities has direct consultation, like a curbside consultation available to help with current patient care, right? So we don't want you to send us your patients. We want to help you care for them in the setting that they're already receiving care in. So this line is really focused on being that physician to physician or clinician to clinician support. So we have a team who can talk to a physician, a clinician, a therapist, et cetera, and can help walk them through diagnosis, treatment planning, preconception counseling. Again, this is not necessarily for the patient or individual themselves, but it's really for supporting the providers who are managing their care. Next slide, please. Our last section is really on making sure that you all understand the importance of connecting all of these initiatives and connecting to all of the initiatives, right? So the goal across the board for all of these initiatives, all of the agencies and programs doing this work in Kansas is to have a point of connection to support in every single community for every single mom and every single family in every moment of need, right? We want to reduce maternal deaths. We want to improve outcomes. We want our moms and our families to be healthy and well and safe and supported. So, next slide, please. To do that, we want to make sure that we are connecting individuals, connecting professional groups, and connecting moms to care. So these are some of the key professionals in the systems of care in the state who are working to support new moms. Um, and it's if you are in this group or in any of these groups and you feel like you could be better connected, again, please reach out to KCC. We are more than happy to have a conversation with you about how you can connect or plug into some of these other initiatives, how you can support some of this work, and any other questions that you really have around getting connected to this work in Kansas. Beyond this group though, this like bullet list is amazing. They do so much work for moms and families in the state, but we really also need to make sure that we're taking on that personal responsibility of supporting the new moms in our lives. That support can look like direct support, like checking in, helping with meals or laundry, like listening, caring for the baby while mom or dad takes a nap or a shower, or just taking a break, right? Every parent needs that. Every new mom needs that support. But this support can also be connecting a new mom and family to some of the resources that are listed on this page, whether it's helping them identify what's available locally, um, really helping that new mom or family get plugged into something like home visiting or WIC services. Um, or supporting mom so that she has a transportation child care, she has like the emotional and social support to really follow through with accessing some of these services. Parenting is really hard. It truly takes a village to raise a child, and every single one of us plays a part in being that village of support for the new moms and families in our lives. Next slide, please. All right, I think I went a little over time, but I believe we have some time for questions and responses.
Yeah, if anybody has a question, you can absolutely feel free to come off mute and ask that question, or you can utilize the chat feature as well. And Erica has also been dropping all of the relevant links into the chat too. So if you needed access to any of those, you could go ahead and click on those links. I've just gotten some thank yous and some great presentation with tons of info, Jen. So just some compliments to you for your presentation this afternoon.
Thank you all, and thank you for being here. I know this was a lot of information. There's so much work happening in the state. And so if you review with this, sit with it for a little while. If you do have questions, I'm always available. You can contact me through the KCC team and that line. You can also connect through really any existing connection you have at CPPR. Um, and happy to follow up with any questions after the presentation as well.
Awesome. Thank you so much, Jen. Like everyone is saying, that was wonderful information, so many resources. And please remember that these slides will be posted on the Children's Cabinet website on the event. And then we will also post the recording and some links to the Children's Cabinet YouTube channel as well. So I am going to move forward with our early childhood systems updates. Just have a few of those and then we will wrap up for the afternoon. First, our 2024 draft All In for Kansas Kids strategic plan. My colleague Erica Figueroa, this was actually our presentation for last month at this webinar in March. She went over some of the details of the plan and got people's feedback and directed them to this information as well. But if you were not available last month, we have a draft of the All In for Kansas Kids strategic plan that is currently up on the Children's Cabinet website, with all of the needs of our youngest Kansans and their families fresh in our minds from the 2024 All In for Kansas Kids needs assessment. Leaders in Kansas are mapping out our state's future direction for early childhood. And all voices from Kansans are vital to ensure that our goals and action plans going forward reflect what is needed to help every child thrive in Kansas. So Erica will be putting a link to that draft All In for Kansas Kids strategic plan into the chat. You can provide feedback by following the link to the survey that will also be placed in the chat. And there are 2 feedback sessions coming up for families, one being held on a Saturday at noon on April 13th, and another being held on an evening weekday on Wednesday, April 17th at 6:30 p.m. So registration for both of those, you will be able to find those links shortly in the chat as well. So the draft 2024 All In for Kansas Kids strategic plan is organized into 3 pillars: ecosystem, workforce and work environments, and experiences of children and families. So this plan builds upon the work of the past 4 years outlined in the 2020 All In for Kansas Kids strategic plan and reflects principles from the Kansas Children's Cabinet Blueprint for Early Childhood, promoting healthy development, strong families, and early learning. So please share this information with your colleagues, your friends, your community members, and those that you serve, as all are invited to provide feedback from now through April 19th. So that window is closing. We have about 9 more days. So please take a look at our draft All In for Kansas Kids strategic plan and let us know your feedback. Next, I have a save the date for a parent and caregiver fireside chat. Parents and caregivers are invited to join this monthly virtual parent caregiver fireside chat. It is intended to create connections for parents and caregivers across the state. And this session on April 22nd from 6 to 7 p.m. will be dedicated to the critical topic of early childhood development, health, and screenings. There will be guest co-hosts from KDHE and KSDE. This opportunity will provide valuable knowledge and insights to state and local resources and connections, while providing engagement opportunities to ask questions, provide feedback, and spark conversation. So why should you attend? You will receive expert guidance from specialists about screenings. You will have involvement in an interactive Q&A session to get answers to your specific questions and concerns. There will be resource sharing, so discovering a wealth of resources available for your child's development, as well as community connection, connecting with other parents and caregivers across the state. So who should attend? Parents and caregivers and anyone interested in connection, resources, referrals, and early childhood development. So we want to embark on this journey together to support the brightest start for our children in Kansas. Your presence and participation will enrich the discussion and enhance the family experience. Registration link for this virtual fireside chat can be found in the next edition of the All In for Kansas Kids e-newsletter. So that will go out on next Monday, and it will also be up on the website as well. So another reminder, sign up for the All In for Kansas Kids e-newsletter, and you will receive that information. Next up, our early childhood recommendations panel is currently accepting applications for the 2024-2025 term. The Kansas Executive Order 20-02 designated the Kansas Children's Cabinet and Trust Fund as the State Advisory Council on Early Childhood Education and Care, and the Early Childhood Recommendations Panel is an advisory group to the Children's Cabinet to support these responsibilities. And currently, that recommendations panel is accepting applications now through May 3rd for any Kansan who is interested in serving on the working group for the Kansas Early Childhood Advisory Council, known as the Recommendations Panel. You can visit the Children's Cabinet website to learn about the knowledge and experience that is represented on the panel and how you can share your voice in this important work. And interested parties can also view past recommendations panel meeting recordings on the Children's Cabinet YouTube page and learn more about the panel from the link in the chat. And the recommendations panel meets on the third Friday of every month from 9 a.m. to 11:30 a.m. So if you are at all interested, go ahead and find those links in the chat and you can apply to be a part of the 2024-2025 Early Childhood Recommendations Panel. A few early childhood conferences that we have coming up. The 2024 Kansas Child Welfare Summit being held on April 15th and 16th at the Townsite Tower in Topeka, Kansas. This is an in-person event, but you are also able to register to participate via Zoom. So the Child Welfare Summit is a joint effort by the three branches of our state government with help from child welfare partners. It is a call to state and local leaders and child welfare justice partners to assemble for the purpose of working together to create lasting improvement in child welfare. The summit will feature the latest expert knowledge as well as activities designed to build collaborative networks between the various roles in the child welfare process. Presenters and activities will focus on practical steps child welfare partners can take to prevent unnecessary involvement in the child welfare system, improve the current permanency process, and empower Kansas families, youth, and young adults involved in state custody. It will also feature voices with live expertise within the child welfare system. The summit's success depends wholeheartedly on the participation of people committed to working together toward this shared goal. And as I said, you can attend this summit in person or join via Zoom, where they have room for 1,000 virtual participants. So this summit is open to anyone that is invested in any way to child welfare, and you can learn more and register through the link in the chat. And also the Southeast Kansas Child Care Conference to elevate early childhood professionals happening on Saturday, April 20th at Fort Scott Community College in Fort Scott, Kansas. This day will include an inspiring keynote presentation by Carrie Ebert, The Power of Play-Based Learning. Participants will get to choose a morning and an afternoon breakout session to attend, and any participants who attend the entire conference will earn 6 hours of KDHE in-service credits. Again, you can learn more and register for the Southeast Kansas Child Care Conference to elevate early childhood professionals in the link that Erica will be placing into the chat. And as always, reminders and next steps. Our next early childhood recommendations panel meeting will be held on Friday, April 19th from 9 to 11:30 a.m. This meeting is always live streamed to the Cabinet YouTube channel, and you can also find recordings there after the fact. Our next early childhood systems building webinar will be on Wednesday, May 8th from 12 to 1 p.m. And the next Children's Cabinet meeting is going to be held on Friday, June 7th from 9 a.m. to noon. And as always, you can find all of these meetings and more on the Children's Cabinet YouTube channel. Stay up to date with us by signing up for that All In for Kansas Kids e-newsletter, following us on X, or formerly known as Twitter, as well as subscribing to the Children's Cabinet YouTube channel. We kept you a little bit after today. Sorry about that, but I hope you got some wonderful information, and we will see you all next month. Thank you so much.